Hello, everyone. We're here at ASTRO 2025, and I'm joined by one of our outstanding breast radiation oncologists, Dr. Matthew Mills.
Hello.
So, Dr. Mills, can you tell me a little bit about some of the exciting research that you're interested in seeing here at the ASTRO meeting?
Yeah, I think that there's a lot of work that is continuing an effort to make the treatment more convenient, with just as efficacious for patients with breast cancer. In particular, there's a few trials that we have some early results for, looking at comparing hypofractionated approaches or shortened treatment approaches for patients to have radiation after a mastectomy for coverage of regional lymph nodes. And so I think that's some promising things with similar toxicity and good control that is kind of pushing us more in that direction. So.
Yeah, and I know you have a really innovative trial that you're planning in the pre-operative setting for breast cancer patients. That's going to be opening with here at Moffitt as an investigator-initiated trial. Can you tell me a little bit about that study?
Sure. Yeah. So right now the paradigm is for radiation to be in the post-operative setting, and in a few other disease sites we found that it's advantageous to move that post-operative radiation to the pre-operative setting, and so that's a technique that is relatively unexplored in breast cancer, and one in which we'd like to see and test to see if that can be advantageous. Yeah, so another kind of area that we're interested in exploring is in the kind of systemic staging for patients following surgery that have some residual disease within the lymph node after systemic therapy. So Dr. Ahmed, did you want to talk a little bit about that concept?
Yeah, so, I think that's an area of active investigation. We have a clinical trial open right now at Moffitt. It's a phase 2 trial that's funded by the Florida Breast Cancer Foundation, where we're looking at doing routine CT screening as well as ctDNA, liquid biopsies in patients who have node-positive disease post-neoadjuvant chemotherapy. So, this is what we've found is that this is a higher risk cohort for local, regional, and distant recurrence. And, the current surveillance guidelines for these patients don't differ from early stage breast cancer patients. And so what we're hoping with this trial is that we'll be able to detect early signs of recurrence and potentially treat those patients earlier as well, too. So that's an open study that we have open at Moffitt as well as at our partner site, Daycare.